let's take a look at those teeth. Now you're opening wide. I just want to first do a visual examination and really analyze what we are working with here. Got good gum tissue, but it looks like you have not been flossing consistently. Is that true? I'm going to scrape your tongue. Good. Just going to do a little tongue scraping. Excellent. Now I'm going to look in your mouth and just observe all of the teeth from the inside. Oh, you've got a little bit of a cavity there, I can tell already. And you have not had your wisdom teeth removed, correct? That one is partially still occluded by the gum. I have to note that down. This one looks a little more healthy, but you're definitely going to benefit from having your wisdom teeth removed. Let's take a look at your soft palate. Good. And back in here. Excellent. Now, the first thing that I'm going to do is just push on each tooth to make sure that there's no soft spots. Nothing so far. Got a little bit of softness up here. And once again. Now I do want to get a little bit better of a look. I'm going to just be observing. There we go. Tongue, keep your tongue down, please. Thank you. Good. Now, I am going to use this little tool to check your gum line. Now, as I said, your gums look a little bit inflamed, so you might experience a little bit of bleeding as I test. Oh yeah, we got a little bit of bleeding on this side. A little bit of gum recession. And let's do the top. Good. Okay, you have a little bit of space between, especially these upper canines to front teeth. And that gum is pretty badly receded. Now, I'm going to use this sharper tool to trace in between each tooth. Excellent. Yeah, you are getting a little bit of blood right there. Okay. Try and relax. Yeah. Very good. Now I do see some signs of periodontitis. on most of your gums. So we are going to give you a prescription toothpaste and mouthwash for that. And hopefully we can nip that in the bud a little bit. Yeah, see there's some gap. I can stick my tool right down there with very little resistance. Those gums should be resistant to my tool. Not bad, but still not ideal. Now, let's see. I think that I'm going to need to do a very complete cleaning, but let's just get a better look in there and say, yeah, these are a little bit impacted. And let's we're gonna do a very deep cleaning today, and so I'm gonna really need to get up under each tooth. Good. Excellent. That probably hurts a little bit. Hold your mouth open like that. Very good. All right, let me do one last inspection. And it's looking good. I'll get in there one more time. Okay, you're looking a lot cleaner, but remains that you are developing a little bit of periodontitis. So as you can see, there's some gum recession, there's some gum inflammation. It's not the worst case scenario, but I do want to see a little bit of improvement between now and your next tooth cleaning, okay? So you're going to be brushing twice daily, flossing or using a water pick, and you are going to be using that prescription toothpaste and mouthwash. So after you use that toothpaste, no eating or drinking for about an hour, and that you're not going to spit it out, you're not going to wash out your mouth after using that toothpaste. It's going to stay on the surface of your teeth, and it's going to help fluoridate and strengthen so that we don't see any further development in these little, they're almost pre-cavities, but they still have the potential to turn into something concerning. All right, good. The dental assistant is going to be in here to fill out those prescriptions for you, and I will be seeing you in about 4 months, okay? Excellent. Bye now.